Thank you. Good afternoon. Please sit down. Please sit down. Secretary Aquino, Dr. Banson, President and CEO of Philhealth, Dr. So Nyun Chu of the World Health Organization, Dr. Willibad Zek of the UNICEF, Dr. Francisco Duque, Chair of the Civil Service Commission, fellow workers in government, honored guests, mga minamahal ko pong kababayan, magandang hapon po sa inyo lahat. In 2010, a single idea made our campaign a true people's campaign. And it said, kung walang corrupt, walang mahirap. If we can eradicate corruption, then we can end poverty. Today, this idea remains at the heart of our methodology to effect lasting and positive change in the Philippines. In the past 2 years, you have seen just how vigorously we have pursued our anti-corruption and anti-poverty reforms. So while we are cleaning up institutions and processes and holding the corrupt accountable, we are also focusing on the programs and projects that truly help Juan and Juana del Cruz. From the conditional cash transfer program to our recently implemented K-12 education program. But to win this war on poverty, we must also turn our attention to public health. And as we focus on the health of our country, economy, government, the overall health of all Filipinos also remains a top priority. We want our people to be empowered individuals capable of standing on their own 2 feet, strong, healthy, and skilled men and women who can take advantage of the opportunities that life affords them. And all of you in the arena of public health are vital to this goal. Those of you in the Department of Health face challenges that seemed almost insurmountable. For example, around 5 million poor families were not covered by Philhealth despite the 4 billion pesos spent by the national government and local government units in premiums in 2010. But you confronted these challenges willingly, finding solutions, cleaning up the systems, and increasing your ability to provide more services, treatments, and medicines to our people. The goal, kalusugang pangkalahatan, a universal healthcare system that provides for the Filipino people quality and appropriate healthcare for type A illnesses like diarrhea to type Z illnesses like cancer, if we go by the Philhealth classification. The Rotavirus is the most common cause of severe diarrhea in infants and children below 5 years of age, or so I'm told by Secretary Ona. We are aware of the dangers the diarrhea poses to anyone, especially in severe cases. For instance, in the Second World War, many more Filipinos died in the prison camps from dysentery than from Japanese soldiers during the Death March. If a strong and hardy soldier trained to withstand the most difficult conditions can die of dysentery, how much more our children who are among the most vulnerable in our population? Diarrhea is an illness that can be prevented given the proper care and environment. But in the Philippines alone, thousands of children suffer from diarrhea each year, with over 3,500 cases leading to death. We can greatly reduce these numbers, and the effort to do this has already begun. Today, we launched the rotavirus vaccines, which are expected to contribute to our goal of safeguarding the health and well-being of Filipino children. For this year, 700,000 infants from the families listed in our National Household Targeting System will be vaccinated. This means that we will be able to protect 700,000 children from the poorest families in our country and give them a stronger, healthier start in life. And this is not the only way. We are fighting to diminish the occurrence of diarrhea-related hospitalizations and death. Lives can be saved through simple measures that have been in place for some time, such as the administration of oral rehydration salt solutions, which can prevent up to 90% of diarrheal deaths. But we know that these strategies work best when used with preventive measures such as breastfeeding and hand washing. And this is also where the rotavirus vaccine comes into play. We are doing all this because we want to be prepared for this recurring threat, because we want to diminish the danger that this condition poses to our children, and because we want to lessen the burden on our people who should not have to worry about their children dying from a highly treatable disease like diarrhea. But we also know that there are illnesses you cannot necessarily prepare for and fight in the same way we are fighting the rotavirus. The worst of these are what we call the catastrophic illnesses, illnesses that are literally catastrophic to one's health, to one's financial situation, and even to one's emotional and psychological well-being. Philhealth classifies them as type Z cases. Our people should not try to overcome these illnesses alone, and this idea is at the heart of our universal health care program. So we're especially proud today to launch the Z benefit package of Philhealth here and in hospitals nationwide. This will comprehensively cover catastrophic illnesses that can lead to death or disability. Among those for the initial implementation are early-stage breast cancer, standard-risk childhood acute lymphoblastic leukemia, and low to intermediate-risk prostate cancer. For the first time in its history, Philhealth now provides benefits that can cover the treatment of diseases that cost roughly 100,000 to 200,000 pesos. This represents a change in the way Philhealth does business. Instead of focusing on one claim or one treatment alone, the focus is on the patient himself, from the surgery to post-operation care and even to therapy. The Z benefit package provides full coverage for our countrymen suffering from dire illnesses, opening new doors to Filipinos in the margins or on the margins of society. So if Aling Nena has been diagnosed with early-stage breast cancer, Philhealth will pay for the entire course of her treatment in any of the government hospitals contracted to provide this package, from cardiopulmonary clearance and surgery to the complete session of therapy and even radiation therapy if it is necessary. For 2012, Philhealth has allotted 3 billion pesos for the Z benefit package, 1.3 billion pesos of which will be used for the treatment of 12,000 people afflicted with either breast cancer, childhood leukemia, or prostate cancer. That is 12,000 fathers, mothers, sons, and daughters whom we are helping directly and whose families need not become mired in debt. The poorest of the poor could not even visit hospitals or see doctors. Now we have found a way for them to receive full treatment for the most debilitating illnesses while sparing them most of the financial burden. If I may emphasize, this is only the initial implementation of that program. Just as Philhealth has dramatically expanded their coverage in only 2 years, so too will they expand the coverage of this program in the coming months. This occasion represents the very goals of our universal health care: to ease the burden of our countrymen already struggling to put food on their tables by lending them a helping hand for their other needs, and to support one and one adult crews from beginning to end in the most common of illnesses and in the most catastrophic. Just as fighting corruption and poverty are the means to ensure a healthier, fairer, and more prosperous society, so too will programs like these help improve our public health system, resulting in a society where the vulnerable are made strong and the weak are empowered to contribute to the well-being and the happiness of the whole. With your help, we have already done so much. There will be many more challenges, both old and new. But if we continue to stand together, we will be able to strengthen not only our healthcare system, but also each and every Filipino. My congratulations, thank you, and good day.